And you're welcome back to Sunrise. We're still live from Studio D at TV3, First in News, Best in Entertainment. All right, so a serious issue now. The breast of a woman is supposed to be a symbol of beauty and womanhood. It's rather unfortunate that cancer of the breast is responsible for the deaths of millions of women around the world. In Ghana alone, it's estimated that about 2,000 women are diagnosed with breast cancer every year. So we're working for the Tatas very soon, and that's what we're talking about. Dr. Beatrice Wiafe-Addae is the president of Breast Care International. Katharina Maggie is also my guest, executive vice president of Susan G. Komen, and they are on Sunrise. I'll be opening the phone lines later on, and what I expect is that you send your calls, and send any issues you have, so that Dr. Beatrice Wiafe-Addae and Katrina will, address your issues accordingly. So you're welcome to Sunrise.
Thank you.
Yeah.
Thank you. Thank you.
Now, if you were to explain to the layperson what breast cancer is, what would you say?
Thank you. Thank you very much for having us here.
Pleasure.
When we talk about breast cancer, we mean cancer that has affected the breast. When cancer grows in the breast, it's termed as breast cancer. It's important to note that it's not everything that affects the breast that is cancerous.
Okay.
There are lumps that can appear in the breast, and most of these lumps are benign.
Okay.
That means they are not malignant, they are not cancerous.
Okay.
But you can't diagnose yourself.
Okay.
So it actually has to be diagnosed by the appropriate courts.
Okay.
And every lump is treated as a culprit until proven otherwise.
Okay.
Breast cancer is the leading cause of death among women as far as cancers are concerned. And it's known that every 69 seconds, a woman somewhere dies from breast cancer. It's also known that 1 out of every 8 women will develop breast cancer in her lifetime. We still don't know the causes, but we know that every woman is at risk. It's mainly the woman's disease, because only 1 to 3% of the patients are men. So being a woman puts one in the risk group.
What is cancer?
Cancer means uncontrolled growth of cells and tissue.
Okay.
And one vital characteristic of cancer is the fact that it can invade, it can spread. If a benign tumor stays at one place, a malignant tumor has the ability to spread to vital organs.
Oscar from Kumasi. Oh, Prosper from Kumasi. Hello, Prosper. Good morning.
Yeah, good morning, madam.
Yes, good morning, Prosper.
I'm calling from Kumasi.
Okay.
My name is Prosper Omega.
Yes, Prosper, you're welcome. You're a man, and so the chances that you have breast cancer are quite low. Otherwise, why are you calling?
The word. So they should do something about it, because of this kind of war. It makes most of the women normally get cancer, so they should definitely.
I'm sorry, I didn't get that. I'm sorry. Again, because of what?
I'm saying that when you look around, even the whole world right now, because of this war problem.
Oh, wars.
Women get cancer, most of them. You see, so the doctor should, at least, they should do something about it to help the women.
Okay. Well, maybe that's Dr. Prosper telling us that wars are a contributory, but all the stress associated might have a connection.
Yes, definitely. I mean, nobody would ever say that war would have anything positive for any nation.
Indeed.
And it's something that we all pray and we actually cherish the peace that we have. But then we can't say that that is a direct cause for breast cancer. Women would suffer more in war, in any war situation.
Yes.
But
and children.
yeah, so it's not only the women who should do something about it. We all have to do something about it.
And we are doing something about it because we'll be working for the Tatas. Josephine is calling from Ebri. Hello, Josephine.
Hello.
Hi, good morning, Josephine. Have you examined your breast yet?
Yeah, I want to ask what's the cause of the breast cancer?
Well,
The brazier.
oh, okay. Thank you, Josephine. I don't suppose Josephine was following from the beginning, but she's asking quite an interesting question. The type of braziers, do they have an effect?
No, we can't say that braziers can cause breast cancer. And I have to say it again and again. We still don't know the causes of breast cancer. And that is why we can't prevent ourselves from getting it. We can't protect ourselves. What we can do is to help ourselves to identify it early and take action. We shouldn't see the problem and sit with them.
Yes.
We should immediately go to the hospital and help ourselves out of the problem. We can educate our women so that they will know the right things to do.
Indeed.
Yes, when there's a problem.
Okay, so let's look at treatment available, if there is any.
Yes.
Katrina?
Yes.
Well, I think I'll let Dr.
Doctor, okay. Again.
Yes, breast cancer is curable. In fact, all the medications...
Breast cancer is curable. No matter the stage of the cancer.
No, it's curable, but only when detected early. Unfortunately, most of the cancers we see in our country are advanced stage. And that is why it's very important that we create more awareness. We try to demystify the disease, celebrate survivorship. Because when we have a lot of survivors, then it will remove the fear. If that woman knows that that lady had breast cancer 20 years ago and she's so normal, going about her normal duties, then it won't be that frightful to go to a hospital and even be diagnosed.
About how many women are you hoping to attract with this work?
We're expecting 10,000 people. Already we have about 11,000 registered. And we are privileged to have the Vice President coming to, champion this noble cause. The Asante Hine Otunfo is also gracing the occasion. And a lot of ministers and members of parliament are also coming. We want every woman to get involved. Those who are in Accra and elsewhere who cannot come should please bring their money so that they support
How
us.
do they do that? Is there an email? Is there a bank account?
Yes, there is an email at Peace and Love 2002.
Peace and Love 2002
at gmail.com.
They
can even come to Wiafe@yahoo.com.
Wiafe@yahoo.com, and that's your personal email address.
This is so dear to me, and I want everybody to come on board. There are people who are helping already. If you
How much are you hoping to raise?
That is the question. We want to raise some funds to pay for women who cannot register with the health insurance. We plan to pay for 1,000 women, but we need people to help us do that. We also need to do more research. We still don't know the causes. We know that breast cancer strikes earlier in the black woman. We have to do something. We don't have genetic clinics. We have to do something, and it's all money. Some people are helping already. Tigo, Hippo Limited, Art Design. So F Malawi, we are so grateful to all of them. Some people have promised, please help us to help our women.
So we must do something. We need your money. You can reach Dr. Beatrice Wiafe on bwiafe@yahoo.com or Peace and Love 2002, Peace and Love 2002 at gmail.com. And so the event, we're working for the Tatars on Wednesday in Kumasi, starting from the Kumasi Cultural Center.
Through Kejetia, Asafo Market, and then to the Babayara Sports Stadium. We are working with brass band, merrymaking, dancing.
We're dancing for the Tatars too.
Yes, and then there will be free breast screening at the stadium.
Excellent.
So we also celebrate our survivors who have come out to share their
I want to ask
story.
quickly what the survival rate is in Ghana.
We don't have the figures yet, but fortunately for us, we have about 500 survivors who are working this year, and we hope to get more than that.
Thank you very much. You're doing a great job. Thank you. So, Dr. Beatrice Wiafe-Addae, President Breast Care International, Katrina Maggie, Executive Vice President of Susan J. Komen. Thank you very much. I suppose you check your breast very often.
Yeah. And that's just the way we are spreading.
All right. Thank you. Thank you very much. Sunrise continues after this.